Hi, it's Dr. Phil once again. I believe you have not really thought about the importance of tears, but after watching this video, dry eye syndrome, where we'll be defining dry eye syndrome or dry eye diseases, or simply dry eye, the causes, symptoms, treatment, and management, eye care tips for dry eye syndrome. You understand the importance of tears in our eye. So simply put, dry eye syndrome or dry eye diseases or dry eye is a condition in which the eye does not produce enough tears, or the tears that is produced evaporate so quickly, and this can cause a lot of discomfort. It can cause tear film instability. By the way, my name is Dr. Fee. As you already know, I am always bringing you relevant and accurate eye care tips, helping you know more about eye health and things your very best today, tomorrow, and in the nearest future. Well, like I already told us, the fact that this disease can cause tear film instability and as well cause a lot of discomfort is enough for you to know that it can as well affect the quality of your life. It can affect your daily activities like reading, writing, driving. It can even affect your productivity at your workplace. So you have to take note of this disease and do the right thing at the right time. Meanwhile, this is Dr. Eye Care Tips. On this channel, you will learn a lot about the eye, vision, and eye care tips for the best of eye health. If you're watching me for the very first time and you would like to learn more about your eye health, kindly click on the subscribers button. You can as well turn on your notification button so you don't miss out on any of our educational videos. Well, if you're following up, you will understand from the simple definition of this disease that tears are really very important in our eyes. So, from the definition, what next are you expecting? What are the causes of this disease? Well, like I already said, the low production of tears is one of the major causes of this problem, or probably the quick evaporation of the already produced tears, whether enough or insufficient. So, if you look at it from the definition, you will understand that these are the two major causes of this problem, dry eye syndrome or dry eye disease. So, specifically, the causes of this disease are one, low production of tears, two, quick evaporation of the tears produced. That means there is production of tears, but it evaporates so quickly. Remember, it is very important for our eyes to be lubricated, to be moist, to be healthy. So when tears are produced, even if they are enough, but they are quickly evaporated, that is a problem. On the other hand, if they are produced but they are not enough, that is another problem. Now, looking at the two causes, they can come together. There can be a combination of the two, which is even a more severe problem. And that is the more reason why you need to always talk to your eye doctor. You need to see your eye doctor so that you will have a better understanding of this situation and be in a better position to take care of it when you still have the time at the right time. Now, what am I trying to say? No matter the cost, see your eye doctor at the right time, do the right thing so you have the best result and save yourself from a lot of discomfort that come from this eye disease. Just to let you know, tears are really very important in our vision and in eye care. So from the definition and the causes of this disease, you should be understanding that tears is something that you shouldn't joke about. So from the causes, what are the symptoms of this disease, dry eye syndrome? Number one symptom is blurry of vision. When you look at things, you are seeing them, but they are not bright enough for you to really say, this is exactly what I'm saying. At one point, you are seeing things very clearly, but when this disease set in, you will see things, but they are not bright, they are blurry. This is where you should be worried about. Immediately you start seeing things blurry, your vision is not clear enough. It is enough reason for you to go to your eye doctor. Let your eye doctor check and know exactly what your problem is. Another symptom we should talk about is gritty or sandy sensation. In this situation, you find out that you have some kind of sandy sensation, as if there are sand or pieces of stone in your eyes. You feel it, you can probably maybe use very clean water, wash your eyes, thinking maybe there are sand or pieces of stone in your eyes. But at the end of the day, it does not solve the problem. This is also enough reason to see your eye doctor. Another symptom is burning sensation. It looks as if you feel very hot sensation in your eyes, as if something is burning in your eyes. This is one of the major symptoms of dry eye syndrome that you should not ignore. Go to your eye doctor, get checked, do the right thing at the right time, and you will have the best result and save yourself from a lot of discomfort. Like I said earlier, this disease can affect the quality of your life. It can affect your daily activity and as well your work productivity. Still on the symptoms of dry eye syndrome or dry eye disease, or simply put, dry eye. We also have what we call light insensitivity. This is a situation whereby you are no more comfortable with light, with bright light. So imagine a situation whereby you don't want anything bright light. How do you manage your daily activities like reading, writing, or probably driving in the night? How are you going to manage? This is where your life, your daily activities are affected majorly. So imagine a situation whereby you need to work under light. It also affects your work productivity. So if you are not comfortable with bright light, when I mean bright light, I mean normal bright light, not too much light. Too much light is probably not good enough for your eyes, but normal bright light. If you're not comfortable with it, it is also a symptom and it is enough reason for you to get your eyes checked. Another symptom we should talk about is mucus discharge from the eyes. Probably very early in the morning, you notice a lot of discharge from your eyes, or even in the daytime, you notice a lot of discharge with redness and this gritty sensation, like as if there are sand in your eyes, coupled with burning sensation, which I mentioned earlier. It is enough reason for you to get your eyes checked. Another very important symptom is excessive production of tears. Like I said earlier, this disease is either caused by low production of tears or quick evaporation of tears, or probably a combination of two. So, in a situation whereby there is low production of tears or quick evaporation of tears that are already produced, the eye seems to produce more and more tears, that excessive tears, to compensate for the quick evaporation or the low production of tears. So in this situation, you see that you have a lot of tears coming out from your eye because the eye is trying to compensate for either the quick evaporation or the low production of tears. Now, the question is, the excessive tearing or production of tears, does it really solve the problem? Well, before we go to the treatment and management of dry eye diseases, a very quick one or a very quick look at the risk factors. What are the risk factors of these dry eye diseases? Number one is age. The older you get, the more likely you are to have this type of disease. So when you are getting older, be ready for some kind of diseases that comes with age. It's not a big deal, so you don't need to think too much about it. You just need to do the right thing. Just know it is normal with aging. So as you're getting older, prepare yourself for the task ahead. Another risk factor here is your environment. Where do you live? How is your environment? It is a very clean environment. Is it dusty? Is it sandy? It also a risk factor to this disease. Another one on the list is your lifestyle. How are you living your life? Do you smoke? Smoking is a very big problem because it can lead to dryness of your eyes. It can lead to quick evaporation of tears from your eyes. What are you doing about your screen time? How long do you spend on your digital device? Do you give your eye a break at all while using your digital device? Are you observing the 20-20-20 rule while you're using your digital device? Do you wear contact lenses? That's another thing you should look into when you talk about the lifestyle under the risk factors of dry eye syndrome. And as well, allergies. How exposed are you to some kind of allergies that can trigger dry eye syndrome? Another thing we should look at under risk factors is medication. Some kind of medication can as well lead to dry eye diseases. Painkillers, glaucoma drugs, antidepressant, and a lot more. That is why it's very important to talk to your doctor before you take some kind of medication. So you know how to take them, when to take them, and when to stop. Another thing that is a risk factor here is surgery, especially eye surgery. Some kind of eye surgery can as well lead to dry eye disease, especially at old age. Some kind of surgery like cataract surgery can lead to dry eye syndrome. Talking about the treatment and management, there are a lot of options when you are trying to take care of dry eye syndrome. Number one, the most common next is by the use of eye drops. So you have to talk to your eye doctor to know the best option to use. We also have ointment, eye ointment. You need to talk to your eye doctor for recommendation. We also have tear stimulation, like I said earlier, low production of tears or quick evaporation of tears, or a combination of both can lead to this disease. So, your eye doctor can recommend tear stimulation to produce tears to compensate for the low production of tears. In rare cases, we can also talk about surgery. In rare cases, that is why you need to talk to your eye doctor. So you know the best treatment options for you. Another very important thing you should do is to give your eye a break. Give your eye a break. Give your eye a break. It is very important, especially when you are making use of your digital devices. Give your eye a break. Observe the 20-20-20 rule. I've already made a video on that. So give your eye a break to avoid dry eye syndrome or the symptoms of dry eye syndrome. Most importantly, we have the natural remedies to take care of dry eye syndrome. This does not involve the use of medications or surgery. It natural. These are the natural ways you can take care of dry eye syndrome. I am going to make a very separate video for that so we understand it better. So watch out for the video on natural remedies to take care of dry eye syndrome. Now coming down to the eye care tips for the management of dry eye syndromes. From the risk factors and the causes, I think avoiding environmental factors. When we talk about the risk factors, we have your environment, where you live, and the situation around your environment. So, avoiding some environmental factors is a very important eye care tip to take care of dry eye syndrome or dry eye symptoms or diseases. Environmental factors like allergies, dust in your environment, you have to avoid them to stay safe. Another thing is to protect your eyes. I always tell us to protect our eyes from the harshness of the sun. Wear your sunglasses, protect your eyes. When you wear your sunglasses, especially the right sunglasses, you protect your eyes from the harshness of the sun and as well from dust particles